Hello everyone. Today we're going to talk about Alzheimer's disease. Alzheimer's disease is a progressive neurological disorder that causes the brain to shrink and brain cells to die. Alzheimer's disease is the most common cause of dementia, a continuous decline in thinking, behavioral, and social skills that affects a person's ability to function independently. The pathophysiology, Alzheimer's disease core neuropathologic finding includes extracellular amyloid plaque, intracellular NFT, synaptic deterioration, and neuronal death. Vacuolar degeneration in the hippocampus and amyloid deposition in the blood vessels may also be seen on tissue examination, but are not required for the diagnosis. The amyloid cascade hypothesis poses that amyloid plaque interfere with synaptic activity and initiate a series of downstream effects that cause increasing inter and intraneuronal dysfunction and ultimately cell death. Some of the risk factors of Alzheimer's. For the first one, we have age. Alzheimer's is usually seen in people 65 and over. The second one is gender. There are about twice as many women as men over 65 with Alzheimer's. The third one is genetic inheritance. The majority of dementia is not inherited, but it depends very much on the particular cause of dementia. There are a very small number of families where it is clear that Alzheimer's is being passed on through the genes from one generation to the next. This obvious pattern is very rare. In a few families where it is clear, dementia tends to develop well before the age of 65. Also, people with Down syndrome have a much higher risk of developing Alzheimer's disease because of a difference in their genetic makeup. So some of the signs and symptoms are trouble with memory. Everyone has occasional memory lapse, but the memory loss associated with Alzheimer's disease persists and worsens, affecting the ability to function at home or at work. Alzheimer's disease causes difficulty concentrating and thinking, especially about abstract concepts such as numbers. Alzheimer's causes a decline in the ability to make reasonable decision and judgment in everyday situations. For example, a person may make poor or uncharacteristic choices in social interaction over wear clothes that are inappropriate for the weather. It may be more difficult to respond effectively to everyday problems such as food burning on the stove or unexpected driving situations. It also affects your planning and performing familiar tasks. One routine activity that requires sequential steps such as planning and cooking a meal or playing a favorite sport become very difficult for Alzheimer's patients. It also causes a change in their personality and behavior. So some of the diagnostic tests for Alzheimer's are MRI, CAT scan, PET scan, amyloid PET imaging, and tau PET imaging. Thank you for watching my presentation.